I'm Jeff Allen, the Director of Sports Medicine and the Head Athletic Trainer at the University of Alabama. After 20 years of working as an athletic trainer, I understand the importance of safety in sports. When an athlete gets injured, proper treatment and follow-up are vital to the recovery of that athlete to get them back out on the field. Today I have with me Dr. Lyle Kane of the Andrews Sports Medicine and Orthopedic Center in Birmingham, Alabama. Andrews Sports Medicine is the official sports medicine provider of the University of Alabama. And Dr. Kane is a sports medicine fellowship trained physician and partner at the Andrews Sports Medicine Clinic and an alumnus of the University of Alabama. And he's a great partner to our athletic program at the university. Dr. Kane, thanks for being with us today.
Thank you, Jeff. I appreciate it. My name is Lyle Kane. I'm an orthopedic surgeon at Andrews Sports Medicine and Orthopedic Center in Birmingham, and I'm very proud to be here with the university. Over my career, I've had the opportunity to work with a lot of not only students and student athletes, but people at the recreational, college, and professional levels, including several from the University of Alabama. Working with these athletes, I've seen many kinds of sports injuries. Our team at Andrews Sports Medicine deals with these injuries all the time, and one of the most common injuries we see is injuries to the ACL or the anterior cruciate ligament. The ACL is one of the main knee ligament stabilizers. It's kind of the central pivot of the knee and is really important for stabilizing the knee for sports participation. ACL injuries happen in one of two ways. The most common is a non-contact injury, so something different than football. Typically occurs in cutting sports where athletes are twisting or pivoting or jumping and they land awkwardly, the knee pops and oftentimes swells up and they injure the ligament called the ACL. A second common way that the injuries occur is through contact sports like football. In this occurrence, most commonly people are hit or they have a traumatic event and the knee blows up or pops and causes swelling and symptoms. The athletes most often affected are people that participate in these kind of sports. It can happen from other things such as skiing, but football, soccer, basketball, gymnastics, cutting sports are very common ways to tear the ACL ligament. This injury is actually more common in female than it is in men. The female athlete is about 7 times as likely to tear their ACL as the male athlete, which is interesting when you look at the numbers of participants. Treatment of ACL deficiency is typically to rebuild the ACL. And what we do technically is we take a little camera called an arthroscope and we use a ligament from another part of the knee from that same person, or occasionally a donor ligament, to rebuild or reconstruct the ACL. This process takes about an hour to hour and a half in surgery, but the rehabilitation is a long process, and that's where Jeff Allen and the medical team come in, treating and rehabbing these injuries. The benefit of today's reconstruction is that it allows most athletes to return to the same level of participation. The success rate for returning to the same sport, same position, and same level of competition is about 98% with today's techniques. The problem is it takes a long time. It takes 4 to 6 months, and sometimes for certain sports as long as 8 to 12 months to get back to full competition. So we really depend on the university medical staff, on Jeff Allen, the athletic training staff, physical therapists that are involved to get these athletes back. But it's a great team we have here, and we're very proud to be part of this team.
Thank you, Dr. Kane. You know, an ACL injury, there's no question, can ruin an athlete's career and really make a big difference in a team season. And that's why it's such a pleasure for us to work with such a great group. We know without a doubt that when we have an athlete that has an ACL injury, that they're going to be in great hands. The surgery technique's going to be fantastic, and we know that they're going to have a great outcome because of our partnership with the Andrews Sports Medicine Clinic. So thank you, Dr. Kane. I appreciate all you do for us.
Thank you, Jeff. And we at Andrews Sports Medicine are very proud to be part of the university. We're committed to giving our athletes and the people in our area the best they can do in treatment, therapy, and preventative education for these athletes. If you have any questions about ACL injuries, we actually have a website called www.andrewscenters.com, or you can contact us at 205-939-3699. And we can tell you more about the injuries, and we can evaluate your injury if you need it.